Hi friends, I am Dr. Pratap Singh Rathod. I have done MD in Forensic Medicine, and today we'll continue with sexual offense chapter. In this video, we'll discuss about examination of an accused person in case of sexual offense. So, examination of accused is done first when if the survivor is able to identify the accused. So, if she is able to identify the person, then he will be taken by the police station to take his statement and to be examined. Then he is taken to hospital for examination proper. The general procedure of examination of accused. So it is similar to that of a victim. So examination is similar to that of a victim. It is better to examine the accused after the victim and look specifically for any injuries which she has inflicted. So once we examine the victim, she may tell that certain injuries that may have scratched him or tried to beat him. So we have to look for those injuries like scratch marks, scratch abrasions or bruises which she may have caused. That will be helpful for correlating with the history given by the victim to the injuries on the accused. If possible, accused should be examined by the same doctor who is examining the victim. So first, the consent of the accused is taken for a general physical examination, and it should be explained to him that after report furnished to the police and court, which may go against him, and he has a right to refuse the consent. So it has to be explained that giving consent means any findings which doctor obtains is going to police officer, and it can be against the findings may go against him. But in certain cases, if the person doesn't give consent, then Section 53(1) CRPC will be applicable, which states that accused can be examined and necessary evidence like blood, swabs, etc. can be collected even without the consent and by use of force if such examination is desirable to ascertain the accused part in an alleged sexual offense. So what it states is if it is shown or it is positively identified person is there, and if the person is examined within 24 hours, then findings will be present. So in that case, even if he doesn't give consent, with the permission of police officer who is ranking is not less than sub inspector, with the requisition from sub inspector, the person can be examined without consent, and necessary evidence like blood, swabs, or anything can be obtained even with the use of force. That is the Section 53 CRPC. After taking consent, he should be identified the escorting police constable, and identification marks should be recorded. Examination should begin without any delay, and since signs starts to act disappearing. So any injuries or any injuries may disappear. Some findings like foreign hairs may also disappear. So it has to be a person has to be examined as early as possible. Then general medical history has to be taken, which should include past illness, surgical operations, serious accidents, medications, or consumption of any alcohol drinks. So this will be indirectly helpful to the victim. No attempt should be made to obtain a history of specific incident. So questions should not be asked to the incident proper, but questions may be asked related to say his sexual behavior, his his activity or sexually how he is active, and also should be found whether the person had any consenting intercourse with any person within previous 24 hours. This will tell that his point of view of the offense, whether he thought that the consent was obtained before having sexual act, and whether he had any sexual partners within 24 hours also been noted, since findings present may be correlated with that of a sexual offense. Then in the examination part, the date, time, and month and place of examination should be noted. Then you go for general physical examination. So general physical examination is mainly concentrated with the person's development. So age, development of the genital organs, and physical power of the accused should be noted and compared with that of female to determine the possibility of his overpowering her. So it is mainly done to know how the person's build is present. Like if the person is very thin, underweight, like 40 or 50 kgs, and the woman is about 60-70 kgs, then it is very difficult to, it is very easy for the victim to overpower the accused. So that has to be noted down. His mental status, general behavior, whether he is dazed, shocked, distressed, calm, cooperative, or aggressive should be noted. And this behavior can be useful whether he is guilty of the charge or not. If he appears to be under the influence of alcohol and drugs, it should be noted, and necessary sample specimens should be collected, which mainly includes blood and urine should be taken, whether the person, if it's suspected that person is under the influence of some drugs. Then clothes of the person has to be examined. This will be helpful if the person is brought to the hospital within 24 hours, if the person has not changed the clothes, or if he has not taken the bath. In these cases, this will be helpful. The clothes should be examined for presence of tears, loss of buttons, presence of any hairs, fibers or foreign materials matter. Mainly the hairs of the victim or any fibers, anything, cloth fibers of the victim may also be present on the person's cloth. Any foreign material, like if the person has been a scene of crime, any foreign material like soil, anything may be found. Some cosmetic contact traces like face powder, lipstick stains or fondant or anything of the victim may be also found on the person's clothing may be present. Any blood stains present on the clothes should be noted down. Mud, other stains, grass, etc. if on the cloth is present should be noted down, which will be helpful to correlate examine the scene of crime. Then seminal stains on the cloth, if it is present, has to be noted down. Where it is present, location has to be noted down. Then particles of earth or fibers should be noted down. Again, it will be helpful to examine the crime scene and to examine whether this is correlated with the crime scene which the victim has given the history of. Then nail scraping should be examined for presence of blood, epithelial cells, fibers, etc. So if the person has been overpowering a victim, so many chances that he may have scratched her, so there may be blood, there may be epithelial cells, there may be sometimes any scratch material of any sand or material may also present under the nails. Marks of struggle such as bruises, scratches, teeth bite marks on the face, neck, hand, chest, trunk, buttocks, upper limbs or thighs, genitals should be noted down. So if the victim may try to overpower him, so she may have tried to bite him. So teeth bite marks may be found anywhere on the body, and scratches, if she has scratch marks will be present. If she has punched him, then bruises will also be present. Presence of matting of pubic hair indicates that there was emission of semen, and it will be helpful to know whether there was penetration or not. Female hair on the hair, face, body or clothes of accused, if present, should be collected, and it had to cross-examine with that of the victims. Existence of venereal disease, any signs of venereal disease is present has to be noted down, and those signs, if the victim is examined after a few days, then this signs, if she has same venereal disease, that will be correlating. Then we go for examination of genital purple. This is mainly again done to know the general physical development, whether the genitals are developed well defined, and whether he is capable of having sexual intercourse or not. The development of genital organs is noted down with specific reference to the potency. Any scratches, abrasions, and bruising on genital has to be noted. Post-pro penetration against resistance to virgin hymen may produce tears and bruising, especially in cases where if the person has sexual intercourse with the children, there is deep disparity between the penis and the vagina. So there is chances that there may be bruises may be present on the glands. Sometimes, if there is forceful sexual intercourse, then frenulum will be teared. Frenulum is the part which attaches the glands prepuce with the penis. So those frenulum will be teared also. Sometimes there may be scratches may also be present. Those all things indicates that there was some forceful sexual intercourse was present. Suspect's penis is washed with saline water and the material is stained with peptidoglycol stain. So, the examining of peptidoglycol stain, vaginal cells, vasovagal cells, and bars orbit can be identified, which suggests that there was some recent intercourse was present. Then, glands is examined for vaginal cells. So, this is done by cleaning the organ with the filter paper and exposing the paper to vapors of glucoside. So, if there is vaginal epithelial cells present, it will become brown in color because of presence of glycogen, which is seen mainly in the vaginal epithelial cells. So, once the clean glands is exposed to leukocytin, it becomes brown in color. If the accused is not circumcised, foreskin may be retracted and presence or absence of smegma should be noted. So smegma is a part which get deposited near the sulcus of the glands. So it get deposited. This is a matter cheesy material which is present in the sulcus glands, the sulcus of the glands penis. This gets deposited every 24 hours, and it is not present in cases of recent sexual intercourse. In case of recent sexual intercourse, it will be absent, and also if the person has washed or taken bath, it will be absent. So absence negative, it is present, not stigma. If stigma is absent, it indicates that the person may have some recent sexual intercourse, but presence of stigma excludes that the person may not have sexual intercourse within 24 hours. So it will mainly helpful if if it is present, that indicates that he may not have sexual intercourse within 24 hours. If it is not present, it just only indicates that he may have sexual intercourse or he may have washed the genitalia. Then specimens which has to be collected from the accused. Similar to specimens collected in the victim, certain specimens has to be collected from the accused and sent to forensic FSL lab for confirmation. First of all, is swabs from corner sulcus, prepuce, spinal shaft, and urethral orifice is sent mainly to identify the vaginal cells, vaginal epithelial cells, to examine whether the epithelial cells are present or not. It has to be examined. Then blood is done. Blood is collected for grouping. Again, this is cross-examined with the victim, and if there is some epithelial cells under victim's nail scraping, can be cross-examined for blood groups. Pubic hair combings, any avage pubic hairs. So any loose pubic hairs which is present has to be collected. Some pubic hair may be from the victim also, so that has to be cross-examined. Matted pubic hair is cut at the root level and taken for examination. Head hairs, any loose hairs combed. So if any head hairs are combed, any loose hairs may be of victim may be also present. Loose hairs found anywhere on the body has to be collected in nail scrapings. So if the accused may have scratched also, at times under the nail scrapings there may be presence of epithelial cells of the victim. So this also happens to be collected. Lastly, opinion of the accused should be given. Opinion only after in the report of examination accused, mainly it should consist both the positive and the negative findings. All the findings favoring the accused, all the findings favoring the victim also should be present. The opinion of the doctor should only suggest whether the accused is capable of sexual intercourse or not. He may not be, he will not give any opinion related whether he has done a sexual intercourse or he has done sexual offense or not. So his report only, the doctor's report only will be applicable. The findings, collection of samples will be important. Other than that, opinion will be only based on that whether he is capable of sexual intercourse or not. These are my references. Thank you.